Hello, my name is Kate Dotsikas, and today I will be talking about one of my fellowship projects, Trajectories of Housing Cost Burden and Mental Health Problems, a population-based cohort study. Since the 2008 financial crisis, a lack of consistent access to affordable housing is a growing concern. The UK faces some of the highest rates of unaffordable housing in Europe, and many have been left with a significant burden of housing costs. This burden may pose a risk to mental health. A link has been established between mental health problems and poor housing conditions, but longitudinal housing affordability research is limited. Furthermore, no study has examined different trajectories of housing cost burden over time and their distinct relationships with mental health. This study aims to determine the longitudinal relationship between housing cost burden trajectories and mental health. We use data from the UK Household Longitudinal Survey. Information for our study was taken from the household owners or renters across the UK, with data collected annually from 2009 to 2011 until 2018 to 2020, waves 1 to 10. The primary outcome for our study was mental health problems, measured using the 12-item General Health Questionnaire, or GHQ, at wave 10. The main exposure was trajectories of housing cost burden, a binary variable indicating 30% or more of household income spent on housing costs was calculated at each wave. Covariates from wave 1 included age, sex, country, ethnicity, and a binary cutoff above or below the median household income. First, we used group-based trajectory modeling to determine subgroups following distinct clusters of housing cost burden trajectories across waves 1 to 9. We used the data package Traj and assessed model fitness by comparing the Bayesian information criterion. Secondly, we used linear regression to estimate the relationship between housing cost burden trajectories and GHQ score. The final analysis was based on a sample of 30,026 participants. Seen in this graph, the trajectory modeling confirmed a 6-group solution. The stable low group in brown included more than half the sample, with a consistently low probability of facing a housing cost burden. The remaining 5 groups are represented by these trajectories: stable moderate in yellow, steady increase in green, rapid decrease with slight increase in purple, stable high in blue, and high falling in red. The stable high group had the youngest mean age, the highest mean GHQ at wave 10, and the highest proportion of non-white participants and participants from England. The results of the linear regression showed that compared to the stable low group, people facing successive time points with a high probability of a housing cost burden had a higher risk for poor mental health. After adjusting for age, sex, country, and median household income, evidence of an association with GHQ remained for all but the rapid decrease with slight increase group. The impact was greatest for the stable high and the high falling groups, who had GHQ scores on average 0.61 and 0.93 points higher than the stable low group, respectively. In conclusion, in a large population-based cohort, we found that trajectories of housing cost burden over 9 years were associated with mental health problems. The mental health impact was largest for groups exposed to a current or past cumulative housing cost burden. To our knowledge, this is the first study to examine trajectories of housing cost burden and mental health. The large difference in GHQ score for both the stable high and high falling groups suggests that cumulative exposure to housing cost burden has a sustained negative impact on mental health, even in the absence of current affordability problems. The results support the need for interventions that not only target populations currently experiencing a housing cost burden, but also those that may have been exposed to an accumulation of a burden in the past. Future research should consider the particular experience of specific subgroups, including different age or ethnic groups. Thank you.